Now, this is an interesting story right here, and it's about a topic that I haven't talked about in a while, and that is the topic of HIV. And if you notice, it's some PC people in this picture right here. It says save lives, CDC recommended. Now, you would not have heard about this story because mainstream media did not put it out there at all. As a matter of fact, if I did not see this posted on social media, I wouldn't have heard about it. Now, the article I'm going to read from was posted 6 days ago, but the story itself actually broke 2 weeks ago. So we're talking about like the beginning of April when this happened. So with everything that was going on at that time overshadowed this story. Now, what location this is in probably one of the most rural places in America, and that is West Virginia. I mean, straight up Hicktown. I haven't been to West Virginia in years, and when I did go there, it was only because I was going to the casino that was there. Those who live in the area where I'm from know exactly what casino I'm talking about. But when they built Maryland Live in Anne Arundel County, people stopped kind of going there who didn't live close to there, and when they put MGM there, it was a wrap. But basically what's going on in West Virginia is that they have a huge HIV outbreak going on out there. So think about this. They have a huge HIV outbreak along with opioids and COVID-19. Now, based on what I read so far, the spread of the HIV out there is not coming from sex or sexual intercourse. It's coming from the sharing of needles. And we all know what that means. Because that just basically means that all of them out there, well, not all of them, but most of them out there are on drugs, are heavy narcotic that involves injections, but they're not using clean needles. They're sharing needles. And that's basically another way that you can spread HIV, because there's 3 ways that you can spread it. It might be more, but it's 3 common ways. The first one is the obvious way, and that's through sex. The other way is through a blood transfusion, which is basically you got blood of someone donated to you who has HIV and that's in your system. The third way is the one we're going to talk about today, and that's the sharing of dirty needles. So this is probably going to play on more, of course, with the opioid plague, because in rural America, that plague is eating their ass up. But I'm going to go ahead and get into this article. West Virginia Governor Jim Justice on Thursday signed a law restricting needle exchanges in the state, likely shuttering or driving many underground. The move came despite a worsening HIV outbreak, a crisis that needle exchanges have repeatedly been shown to help stop. In February, a CDC official told the Charleston, West Virginia City Council committee that the country's most concerning HIV outbreak was occurring among people using injection drugs there. Now, you want to know what's so interesting? Whenever you hear of HIV and AIDS, they always plant or show a black face in there somewhere, like all the time. Even when they talk about different commercials, if y'all see commercials on television, they will show a black person in there, and it's usually a black person who's in the academy. And I'm not saying that trying to be funny, but it usually is. Talking about HIV and AIDS. But what they don't talk about is the PC people that have it as well. And it's mainly because of the way that they get it. And that's through drugs and needles. Not saying they don't get it through sex, but I think it's more common that many of them get it through needle and like through shared needles, like in this situation right here. So they barely talk about their opioid plague, and they're not going to talk about this either. I'm not surprised. Despite needle exchanges helping limit past outbreaks in Indiana and West Virginia, the state will now regulate the programs for the first time. It's a move that supporters such as Justice say is based on good science, but which public health experts say will hobble the programs, worsening the HIV outbreak and leading to more people dying from drug overdoses. You're actually talking about human beings here. This will kill them or make them sick, Laura Jones at Milan Puskar health right in Morgantown, West Virginia, told BuzzFeed News. Programs in one of the 3 counties Jones program will operate in will most likely be shut down by the law requirements that county politicians and city officials approve of them. This is going to drive some programs underground, she said. The basic idea behind needle exchange is shown to be effective in 2 decades of public health research and endorsed by the Trump administration is to give new needles to people using illegal drugs so they don't share used ones and spread disease, while also offering them to healthcare and an entry point into treatment. So there you go. Remember, Lisa and myself talked about this opioid plague for years now. And one of the things we talked about was these safe injection sites that they have, which basically allows them to go there and shoot up without overdosing. And I think maybe because of what happened with WUVID, production slowed down and they probably didn't have enough syringes to go around. So what they started to do was, quote unquote, recycle them without cleaning them. And then everybody started using each other's needles, to get a hit, to get a high, to get a rush, adrenaline, whatever you want to call it. And that's what has led to this right here. There are more than a dozen needle exchange programs in West Virginia already hit hard by the nationwide epidemic of illicit opioid drug use and overdoses. The HIV outbreak in Charleston followed the city ending its own needle exchange program in 2018 over complaints about needle litter. Similarly, nearby Cabell County limited its program that year to people willing to use state identification, which costed half of the participants and sparked an HIV outbreak there. When you have an HIV outbreak, you want to get needles to as many people as possible. This law will instead shut down almost every program in West Virginia, said West Virginia University public health expert Robin Pellini. Local politicians are unlikely to okay the programs. Additionally, the restrictions contradict CDC guidelines for needle exchanges, making it likely that the other health conditions like hepatitis and endocarditis will increase along with drug overdoses, since the programs are a leading provider of the overdose reversing drug naloxone in the state. This will be the strictest needle exchange law in the country, and I'm worried it will be a model for other states trying to regulate them out of existence. Supporters of the new law, such as sponsored State Senator Eric Tarr, have said it is aimed at eliminating needle litter in programs that don't automatically enroll drug users into recovery programs. Among other restrictions, the law could require needle exchanges to label syringes linking the needle to a user and mandate state licensing to operate. Against CDC recommendations, exchanges would strive for matching the number of needles handed out with the number of returns. Could only give needles to people with state issue identification, discouraging people experiencing homelessness or people using illicit drugs who fear being arrested from participating, and would prevent people from picking up needles for other participants, which can be helpful in a rural state with limited public transportation. The law seems particularly aimed at needle exchanges not connected to local health departments like Charleston's solutions-oriented addiction response nonprofit. Charleston's police department investigated SOAR as it's abbreviated, in undercover operations before concluding in January that it wasn't breaking any law against operating without a license. Because the state doesn't offer licenses, the group helped uncover the HIV outbreak in Charleston last fall by offering testing to participants along with food and medical care. In late March, Senator Joe Manchin of West Virginia demanded an inquiry into the CDC's finding of an HIV outbreak in Kanawha County, where Charleston is located. Instead of asking for help from the federal health agency, as would normally happen in such an outbreak, Kanawha County commissioners questioned the CDC's evidence for an HIV outbreak based on medical test results reported to the state's health department. The city has postponed voting on its own needle exchange ordinance until April 19th, which of course has already passed, while it waits for the state licensing law to go through. There is no doubt in my mind or any freshman public health analysis that this bill is an HIV spreader, said SOAR co-leader Joe Solomon in an email. We're not going to let more of our people die or get HIV if we can help it. Imagine if giving out masks were illegal during COVID-19. Would you still make sure your family and loved ones were protected? Asked Solomon. Of course you would. One thing that this just tells me right here is that they need to focus more on this instead of whatever else we got going on. But we know they're not going to talk about it. Hell, when they tried to reach out to 45 to have him declare the opioid plague as a national health crisis, which for them, I guess it would be, because, you know, when it was us, it wasn't called a health crisis. It was just called the war on drugs, but we know it was the war on something else. It was really the war on black people. But, you know, we know code speak over here. But it was 45 that pretty much rejected it. And that's why they didn't get any true aid. They were literally left to fend for themselves. But, hey, they went back and they continued to vote for this dude. It is what it is. As far as I'm concerned, it is not my problem. I feel absolutely nothing. Because you know what's so funny? When black people, you know, are disproportionately affected by AIDS and HIV and STDs such as, you know, like that, especially those two, we didn't get all this support. Just like when it came to the crack era, we didn't get that support. So I'm just returning the favor. You're not going to get any support from me, to be quite and completely honest. They are on their own, as far as I'm concerned. Y'all let me know what y'all think about this down in the comments. Like, share, subscribe if you have not done so already. Make sure that you text the number that is pinned down in the comments below so you can receive notifications every time I go live or upload a new video.